The operating room can be a daunting place for patients. Bright lights, strange sounds, and just the thought of undergoing a procedure can be overwhelming. As an operating department practitioner, you're a vital part of the surgical team, making sure of patient safety and well-being throughout their surgical journey. And that journey doesn't end when the surgeon places the final stitch. Your role in the post-anesthesia care unit, often called the recovery room, is honestly just as crucial. Imagine the recovery room as a haven for patients emerging from the depths of anesthesia. It's where they transition back to consciousness, where the fog of surgery begins to clear. This transition is a delicate and potentially vulnerable period for patients. They need specialized care and constant monitoring as their bodies recover from the effects of anesthesia and surgery. That's where you come in. Your expertise in recovery care ensures that patients wake up safely, comfortably, and with any potential complications promptly identified and addressed. Your role can be the difference between a smooth recovery and a difficult one for the patient, making your presence in the PACU absolutely indispensable. The PACU is a hive of activity, but it's also a place of meticulous organization and calm professionalism. It's a specialized area right next to the operating rooms, specifically designed for monitoring and managing patients recovering from anesthesia. Picture a ward with individual bays or cubicles, each one equipped with essential monitoring equipment. As an ODP, you'll find yourself surrounded by a team of dedicated professionals. Anesthetists oversee the recovery process, providing expert guidance and managing any complications. Nurses work alongside you, providing essential nursing care and support. Together, you form a cohesive team dedicated to ensuring the best possible outcomes for every patient. The PACU is more than just a room with beds. It's an environment where cutting-edge technology meets compassionate care, and you are at the heart of it, using your skills and knowledge to make a real difference in patients' lives. The patient's journey from the operating room to the PACU is marked by a crucial point: the handover. This is when the anesthetist, who's carefully monitored the patient throughout the procedure, entrusts their care to you. The handover is a carefully choreographed process that makes sure all vital information is communicated clearly and effectively. During the handover, the anesthetist will paint a comprehensive picture of the patient's surgical journey. They'll detail the type of surgery performed, the anesthetic agents used, any complications encountered, and the patient's overall condition. They'll also highlight any specific concerns or potential issues to watch out for during recovery. Your role is to listen attentively, ask clarifying questions, and make sure you fully understand the patient's history and current status. With the handover complete, the patient is now under your watchful eye. Your first task is to perform a comprehensive initial assessment, a systematic head-to-toe evaluation that forms the foundation of your care plan. This is where your skills and knowledge truly come into play. Begin by assessing the patient's airway. Make sure it's clear and unobstructed, allowing for easy breathing. Check their breathing pattern, noting the rate, rhythm, and depth. Listen to their chest with a stethoscope to ensure clear breath sounds. Next, evaluate their circulation by checking their heart rate, blood pressure, and capillary refill time. These vital signs provide crucial insights into the patient's cardiovascular status. Finally, take note of any devices or drains in place. This might include intravenous lines, urinary catheters, or wound drains. Make sure they're functioning correctly and document their output. Your meticulous assessment provides a baseline for ongoing monitoring and helps identify any deviations from the norm. In the PACU, vigilance is your greatest ally. Patients recovering from anesthesia are in a vulnerable state and their condition can change rapidly. That's why continuous monitoring is honestly absolutely paramount. Your keen observation skills can mean the difference between a smooth recovery and a potentially life-threatening complication. Regularly monitor the patient's vital signs, including heart rate, blood pressure, respiratory rate, oxygen saturation, and level of consciousness. Look for any trends or changes that might indicate a problem. For instance, a drop in blood pressure could signal bleeding, while a rapid heart rate might suggest pain or anxiety. Beyond the numbers, observe the patient's overall appearance. Are they in any distress? Are they pale or flushed? Do they seem confused or disoriented? Any of these signs could point to an underlying issue that requires immediate attention. Remember, you are the patient's advocate and your attentiveness is their safety net. Imagine waking up after surgery feeling groggy, disoriented, and with a dull ache throbbing at the surgical site. Managing pain and discomfort is an integral part of recovery care, ensuring a positive patient experience and promoting healing. Different patients experience pain differently, so a personalized approach is, really essential. Some patients may benefit from medications administered through their intravenous line, providing rapid relief. Others might require oral pain medications once they can swallow safely. Beyond medication, consider non-pharmacological methods to enhance patient comfort. Positioning pillows strategically can provide support and alleviate pressure. Applying ice packs can reduce swelling and numb pain. Simple measures like dimming the lights and reducing noise can create a calming environment that's conducive to healing. Remember, a holistic approach to pain management addresses both the physical and emotional aspects of recovery. As the patient recovers and their vital signs stabilize, the focus shifts towards discharge planning. But before they leave the safety net of the PCU, they must meet specific discharge criteria, ensuring they are ready for the next stage of their recovery. One crucial criterion is a stable airway and breathing pattern. The patient should be breathing effortlessly with adequate oxygen saturation levels. Their vital signs, including heart rate and blood pressure, should be within a normal range, demonstrating cardiovascular stability. Furthermore, the patient should be awake and alert, able to communicate their needs and understand discharge instructions. Pain and nausea should be well controlled, ensuring a comfortable transition home. Lastly, any surgical drains or dressings should be clean, dry, and functioning correctly. Before the patient departs, ensure all necessary documentation is complete and accurate. This includes a record of their vital signs, medications administered, any complications encountered, and discharge instructions provided. Clear and concise documentation is, honestly, essential for continuity of care and provides a valuable reference for the patient's healthcare providers. As an ODP in the PICU, you are the guardian of recovery, the reassuring presence that guides patients through the transition from the operating room to the ward. Your role is multifaceted, demanding a unique blend of technical expertise, compassion, and unwavering vigilance. Remember, your primary responsibility is to ensure patient safety. You are their advocate, their protector during a vulnerable period. Your meticulous assessments, keen observations, and prompt interventions can mean the difference between a smooth recovery and a difficult one. Never underestimate the impact of your care and compassion. A reassuring smile, a gentle touch, and a listening ear can work wonders in easing a patient's anxiety and promoting a sense of well-being. Your role extends beyond the technical aspects of care. You are a source of comfort and support during a time of uncertainty. As you continue your journey as an ODP, remember that the skills and knowledge you gain in the PACU are invaluable. You are an integral part of the surgical team, and your dedication to patient care makes a world of difference in their lives.